Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. And this afternoon we're going to be discussing case number 00213, a 12-year-old Chihuahua with no current symptoms but a history of congestive heart disease and collapse. And so if we think about the body itself, really there's a genetic component to it, and that's the Chihuahua. And then the environment, which is, anything external. And then we have internal, what's happening on the inside and how this all balances out. Because we want this to be balanced to make the best genetic potential for a Chihuahua, because they can live, 20 to 25 years. Average lifespan is usually around 15. And so we want to bridge the gap. And by doing that, we want to understand, why do they do what they do and how can we be supportive? Because right now it says heart, and so we come to the IHC and we see that on the chronic side, the SI3 or lower small intestine was weakened. And then on the acute side, we have cell metabolism and heart. And I'll explain that. Because chronic phase is greater than 3 months. Acute phase is less than 3 months. And so on this little drawing down here, we can see that the heart and small intestine are connected. So that's where we get the SI3 connection, because if the heart's a little stressed, the small intestine will have some weakness as well. And so that supports the GI tract, which is part of cell metabolism. And cell metabolism is inside this little cell. We have these little organelles called mitochondria. And those mitochondria produce energy, ATP, for the body. And so if we have cellular stress, it means that we're overworking these cells and provide either too much energy, which can deplete the body, or over time can cause a lot of free radicals. So these free radicals can cause cellular damage. And so we want good cell metabolism, because this could be a heart cell, and we want to try to maintain the heart's function as long as possible. And so the body tries to make adjustments to keep things away from the vital organs. So since we're in a good place, no symptoms here, we come over, so keep using enalapril and Lasix, because those are going to be the thing that helps the heart the most, the genetic part of it, helps it function better. And then the diet itself, we look at in terms of nutrition. We want to make sure that there's whole food as much as possible. So keep doing that, no adjustments. But we're going to use a product called Chezin from Standard Process, and that helps with the metabolism, because we want microminerals. And microminerals help the heart as far as circulation. So we're just going to add those to the diet. And you get those from us from Standard Process. We order from Standard Process and we can get it in for you. The other thing is we want to balance this out, so we're going to use hemp oil for that. At 5 drops a day conditions the small intestine, cell metabolism, and heart, and gets it balanced out. So we get this cycle back working correctly again to take the pressure off the heart over here, so we don't get worsening signs of congestive heart disease or collapse again. Okay, and so the video kind of gives you a visual, so the idea is you can watch it over and over. But if you have questions, call the office, 847-541-4005, or use our email, groveanimalhospital@gmail.com, in case you have questions after hours. But always feel free to stop by the office and discuss the case, anything that's going on, as much as possible. And we'll go ahead and get this Standard Process ordered in. If you haven't got the hemp oil already, we'll get that ready and you can pick it up at the same time. So if there's any questions, please let me know. Thanks.